You're blocking the TV. What's up?
Open your mind.
That's so creepy. Patient-doctor confidentiality, space cancer, and it's not a tumor.
It's not a tumor.
Today, we are back at it, breaking down and reacting to the concerning medical scenes and futuristic injuries from Rick and Morty. Let's dive right in.
Oh, hi, Dr. Hot Penis.
Wait, Doctor Who?
Doctor Who.
He's using an alias and he chose that as his alias? Oh my gosh. There are unique names out there. You literally can change your name to anything.
It's okay. This alien boy has space cancer, and his dying wish is to see deader people so he can feel superior.
That's awful.
That's awful.
You can't really do that with a hospital. It's HIPAA violations. It's people's private medical information. Only family members and people who are authorized to be there should actually show up to hospitals and visit people.
All you had to say.
Check it out.
They're in a morgue. I've actually never been into the morgue in the hospital, but the morgue is where you were temporarily keeping patients that have died and are waiting to be picked up by family members or released to a funeral home, whatever the thereafter plan is.
Car crash.
Oh,
There's an odor, a smell to it. You can be in these environments for a long period of time because you get something called olfactory fatigue, where over time your senses of that noxious smell actually calm down so it doesn't smell as pungent and odoriferous to you.
Rick, I don't... Wait, what is that smell?
You know goddamn well what it is, baby. Get in here.
Oh, don't do that.
Oh my gosh. Cannibalism is not an appropriate thing. It's not good for our bodies. Humans live a long time, harbor more disease. Eating another human could actually cause us more problems. There's a lot of medical issues related to that.
You've been doing it for weeks. Every spaghetti night. Come on, Morty. Choo-choo plane.
Gross.
Come on.
God damn.
Telling you.
Why? How?
Their cortisol increases the starch content in their bloodstream.
Starch is when we refer to a type of like a carbohydrate, aka sugar.
Sugar.
The cortisol, stress hormone, then increasing the release of sugars in our body to give us energy. Thus, that's what he's describing.
Changing their intestines into one long spaghetti noodle and the surrounding tissues into a spicy sweet hematoma that we would call a bolognese.
A hematoma is like a blood clot. I don't know if you guys have ever had an Italian dinner night. My family used to do that when I was younger. Spaghetti is good, but it's heavy carbohydrates, and so it's a treat more than everyday occurrence.
But it takes a lot of cortisol.
You don't want to be having your cortisol chronically elevated because it actually over time wreaks havoc on our body. Stressed and always in overdrive, and you don't want that.
I'm calling the police.
Before you do that, just...
Rick, stop.
What? Where am I?
In a morgue, eating bodies.
Where what?
Stop using that thing.
What thing? Who are we?
We were just leaving.
All you had to say.
That device looks like the device from Men in Black where you basically forget things.
Yo, Summer, get over here and meet the team captain.
Oh, interesting.
Interesting.
You're embarrassing yourself. Leave, or I will make you leave.
Just let me borrow it for a second, then I'll go.
What do you even want it for, you parasite?
I want to be ripped and take my shirt off in front of Trisha.
Being ripped, people have been trying to do it forever. It's basically a simple formula of good diet, good rest, and exercise.
Not so strong now, huh?
Oh my gosh, look at that. Almost reminds me of like Megamind, this massive brain. The brain wouldn't necessarily get that big because the skull is a confined space of hard bone. If the brain swelled that much, it would actually start causing pressure on itself and try to squeeze out. Oh, we're going in the pool. Oh, geez. What the? Okay, she's back to normal.
You're mine.
What the heck?
What the hell is going on here?
How did they fuse together into the abdomen? What the heck?
You're blocking the TV. What's up?
Open your mind.
That's so creepy.
This is a Quado from Total Recall. They're basically the crown jewel of psychic mutants.
Yeah, everyone knows but me. They f***ing shamed me for it.
Oh, interesting. Super cool image. So it's almost like an x-ray, but not. You wouldn't see the soft tissue relating to the brain on an x-ray. You would just see soft tissue, air, and bone.
Your spines are braided? Christ, what a mess.
You need to fix this, Grandpa.
Super cool. People have been born as conjoined twins where they need to separate the individuals, but you have to be careful because of shared organs. Is that possible to separate, or do they have to stay together because they wouldn't survive one without the other? Whoa, bullet blowing off the side of the face, missing the teeth, but could that happen? Yes, you can actually have a significant amount of soft tissue injury to that area. Obviously, if that happens to somebody, compress the area, get to the hospital. You just need a significant amount of plastic surgery. Oh my gosh, a nosebleed. Sometimes the blood could actually get caught up and actually start going back into the eye. Basically a duct that things can go both directions, so you can actually have blood go back the other way if you have nosebleed, and then you have bloody tears. Whoa! Got the leg that's causing muscle contraction. So we do have devices that you can cause electrical stimulation to different muscles and nerves when implemented. So that's not too far-fetched. Oh my gosh! The strength to just pull and rip somebody's leg off mid-femur. No. I've seen mid-femur amputations due to massive amount of force, like car accidents, but not just grabbing it and ripping it off.
Why don't you have a seat?
Because this isn't a therapy session. I'm just asking you what people in your racket say about handling this particular situation.
It's a little bit demeaning and inappropriate. I'm assuming this is a psychiatrist versus a psychologist. A psychiatrist is a doctor that went to medical school and is a doctor of psychiatric medicine versus a psychologist, typically somebody who has a master's degree or a PhD.
First, we'd want you to define the situation.
I'm a walking target for a never-ending sea of angry nerds that think getting in a fight with me is some kind of, I don't know, platform. I mean, look at this guy.
This is like real-life trolling, bullying, those sorts of things. Obviously, like me, the YouTube channel, we get people who write comments that are positive, that are negative, that are trolling.
You think locking this man in a chamber and milking him of cosmic fluid will somehow resolve this?
I think it's the best I can do to profit from a situation and maybe set an example.
It's not changing your situation.
Yeah. Now you're gonna tell me to ignore them, but guess what? They want that too.
When people are actually getting bullied or harassed, they feel like they're the only ones that are going through it. Everybody has moments where it does happen, but it's really good to talk to somebody, just like Rick is talking to, appears to be a therapist here.
Is that man dead?
Is everything in here confidential?
Everything but murder.
Then he's fine.
Patient, doctor, privilege, confidentiality. Pretty much everything is confidential, minus if you plan on doing harm to yourself or harm to others. We've done Rick and Morty a few times, but this one was very entertaining. I had enjoyed it. There was a lot of medical stuff going on, a little kind of shenanigans as well. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.